morning, and thank you for joining us for SBB Live. I'm your host, Amanda Barton, and I am excited to be joined today by one of our newest partners, Physical. And I am joined today with Morgan Hinds, who is just a new partner of ours. This is actually our first meeting. So how are you, Morgan? It's nice to officially meet you.
Oh, you as well. I'm very excited to be here. Thank you so much for partnering with us and allowing us to do this with you. We're so excited about it.
I am too. I've heard a lot of great things about your organization over the years, so I am excited to bring you on. So tell me a little bit about how you guys specialize in vestibular therapies and balance.
Absolutely. So Physical Therapy and Balance Centers actually has about 400 clinics nationwide. So there are a large number of us. And to be honest, we treat everything you can think of, from your head down to your toe, everything in between. We are comprised of a very large team of therapists and audiologists, and we do have specialties, particularly in balance and vestibular, but we also specialize in orthoptics and also pelvic health therapy. Me personally, I am at our Bonita Springs clinic in Florida, but I've been with the company for about 4 years, and my passion really has developed to focus on treating the individuals with balance and dizziness related complaints. And so, when you're in school often teaches you a generalized approach to the treatment of balance and dizziness. And it's more meant to treat those individuals that fit a very cookie cutter type presentation. So they don't really educate you on how to treat the people that don't fit that mold. And, that can include the patient that walks in and they've been complaining of dizziness or balance for 2+ years. Honestly, I had someone who once told me they were dealing with it for 20 years. And, by that point, you develop such a strong fear, and you develop a fear of your condition. You develop a fear of falling. So you stop playing sports, you stop exercising. I mean, you've literally changed your life drastically because of this fear. And so school doesn't really teach you how to treat that type of person. But what's amazing is that Physical has figured it out. And so Physical has created a very specific and evidence-based approach that is meant to treat all patients with dizziness and balance. And it starts with a very specific type of diagnosis, and more than just the typical balance, imbalance, or they have generalized dizziness. We want to get down and really identify why they're experiencing those issues. And a lot of times dizziness and imbalance is multifactorial, meaning that it's not just coming from your balance systems, believe it or not. Dizziness and imbalance can come from your neck, and it can come from weakness, and it can come from issues with your systems, including peripheral neuropathy or your ability to sense your feet and the floor underneath you. And it can be caused by glaucoma or visual issues. So there's a lot of things that contribute to an individual experiencing these symptoms. And Physical really prides ourselves on the fact that we look at an individual as a whole. We're not just going in and only looking at one system. We really want to find out what's causing it. And then what we've done is we've created a really stepwise treatment progression that is very individualized to each person. And it's meant to be based off of how they're being classified. And in all honesty, the way it starts is making sure that they have the proper foundation. Because just like you need a foundation to build a house, you can't possibly expect someone to be able to walk or run unless they know how to stand properly. And so, believe it or not, there's actually a lot of people that walk in and the very first position we put them in is lying on their back. So that seems a little weird to a lot of people, because it's like, I'm here for balance, why are you putting me on your back? But how can you expect to stand if you get symptoms just lying down? And so, we have this saying that is basically, we don't like to take spaghetti and throw it at a wall to see if it sticks. And what I mean by that is that we don't take all of our balance patients and just throw them into really complex balance exercises hoping it'll work. And instead, we have a lot of science behind the way we treat. And I'll say in the past 4 years, I have seen so many people with balance and dizziness for so many different number of reasons. And they've ranged from 12 years old all the way up to 99. And I've used this approach of how we diagnose and how we treat these individuals. And the majority of people I see get better in some way or another. So it's really effective. And to be honest, I think it's amazing that Physical has really determined that there is this need for specialists in this field, because as much as we hate saying it, falling truly is an epidemic. And current statistics actually show that about every 11 seconds, somebody does fall and they end up in the ER due to an injury from that fall, or every 19 seconds, someone passes away. And so although we do have those people that they'll fall, they'll brush it off and they'll get right back up, a lot of people, when they fall, I mean, it could be extremely serious. And so us finding a way to treat this is something that, in my mind, is absolutely necessary and is crucial in our realm of physical therapy.
Yeah, and I've always heard that once you fall once, you're absolutely susceptible to falling again. So
Absolutely.
this leads us right into our next question for you. Talk to us about some of the tips that you have. I think you have 6 top tips to keep people from falling at home. So let's talk about those.
Absolutely. So I made little signs because I am a very, very much a visual learner. I can't just listen to someone and understand it. So my very first one that I'm going to talk to you about is number 1, you're going to modify your home. And so what I mean by that is I want you to go throughout your home and I want you to look at the hallways. I want you to look at in front of your door on both sides. I want you to look at your staircase. And I want you to see if there's any clutter, because the majority of us have clutter in some way or another. And honestly, while we're all staying at home, now's the time. Let's start a little bit of spring cleaning. Me personally, my clutter comes from dog bones. I have 2 dogs and they are more spoiled than a toddler. So they have more toys than just about anybody. So my clutter is definitely dog bones and toys just about everywhere. But whatever your clutter happens to be, it automatically increases your risk of falling, because all it takes is forgetting that it's there or not seeing it as you're walking. You hit it and you trip, you fall. And like I said, that fall could be extremely serious. Other things you want to do are, let's look at your throw rug. So I have this big fluffy gray throw rug that I absolutely love. And sure, I believe it creates some zen in the room, but let's be honest. There's a lot of us that have issues picking up our toes every single time we move our leg. And so all it takes is one time you don't pick up your toes, it catches the edge of the rug, you trip and fall. And to be honest, most of the time we have coffee tables nearby and it can be really scary because you can trip and fall. You can hit your head on a coffee table. And so let's take those throw rugs, let's roll them up, let's store them for the time being. I get we all love them, but right now while we're all at home, it's important to reduce that risk. Then let's look at your lighting. So I don't mean you need to go buy really fancy lighting. What I mean is that we want to make sure that there's not darkness everywhere. Your visual system is one of the biggest systems that you utilize for your balance. And so having a lot of lighting so that you can see when you're walking is absolutely crucial. Particularly at nighttime, when you're walking to use the bathroom at night, it's when people are most at risk. And so what we like to tell people is get a bunch of night lights. Me personally, I love the ones that have little fragrances in them, but get a bunch of the night lights, right? Light up your room, light up the pathway to your bathroom, turn on the bathroom light, whatever it is, because in all honesty, we don't want to disadvantage ourselves. And when you're in the complete darkness, that's exactly what you're doing. Particularly at night, I don't know about you guys, but when I wake up, I am not fully awake. And so I am stumbling my way to the bathroom already. And if you add a little bit of light, it can actually go a long way in helping you get there safely. So number 2 is footwear. So footwear is extremely important. We live in Florida, and the number 1 thing I hear is, but Morgan, I like my flip-flops and I like my sandals, and trust me, I get it, but they are not supportive whatsoever. Let's take, for instance, my flip-flop, and don't judge me, but here's my flip-flop, and as you can see, it's worn out on all edges. The bottom is not slip resistant whatsoever. I mean, this is really a terrible piece of footwear for stability. So what I want you to do is I actually want you to take whatever shoe that you are most fond of. I want you to take it and I want you to bend it in half. If your shoe bends in half like this does, you need to throw it away, okay? That shoe is not supported by any means. What we're looking for instead is a footwear that when I go to bend it in half, the toes bend because we need that when we move, but the heel doesn't. And so I cannot physically move that heel, which means it is strong, it is supportive. It's going to support both your foot and your ankle. When we look at the bottom, we do want it to be slip resistant because obviously slipping and falling is a very common way that the majority of people fall. So while you're at home, do yourself a favor, start going through that huge shoe collection you have. Let's look at which ones are going to be best for you to wear right now and which ones won't be. Number 3 is exercise. Exercise is so important, especially right now with everything going on with COVID-19, because we need our respiratory and our cardiovascular systems in the best shape that they can possibly be. And so, there are a ton of bands you can get out there. I have several here that I use at home. They're all different colors. They're all different shapes and sizes. They are great in order to start just any form of strength training. In all honesty, what we're looking for is any type of low impact activity. Go walking, go swimming, just get outside and get those respiratory systems pumping the best that we can. Honestly, they are optimal in order to build up strength, flexibility, stability, all things that are necessary to have a very strong balance system. The 4th one is medication. So now, obviously, we don't have or play a big part in which medications were necessarily prescribed. And I'm not sitting here, obviously, suggesting anybody change their medications. That is between you and your physician. What I am suggesting, though, is that you become educated. A lot of us are taking medications, and 1, we don't know why we're taking them, or 2, we have no idea what side effects they cause. And to be honest, some of the number 1 side effects that a medication will create is dizziness, drowsiness, nausea, headaches, all things that when they come together can absolutely play a part in your ability to maintain equilibrium and maintain balance. So do yourself a favor, just become educated, know what you're taking, know why you're taking it, and really study the side effects. Number 5 are your doctor appointments. So obviously it's a little bit harder right now with everything going on, but I do know a lot of places are offering telehealth too, but there's a lot of options out there. And what I mean by doctor appointments is having those annual appointments with your primary care is extremely important. It's a great way to make sure all your systems are running the way they're supposed to. And it's a great way to catch things early if something does happen. But more than just your primary care, we want you to see audiologists and we want you to see an optometrist, because vision, like I've already mentioned, is one of your main balance systems. So let's go to your optometrist, get your eyes checked, make sure your eyes are healthy, make sure you're seeing as clear as possible. So that way, once again, we don't disadvantage ourselves. Audiologist, because hearing as well is extremely important for your balance. Your ability to hear and sense things around you is a big way that our brain tells us what's going on in our surroundings, and it's a way that we know how to respond to those surroundings and prevent ourselves from falling. So make those doctor's appointments, show up for them, do them on an annual basis. Our last tip, and what I might say is the absolute most important, is you want to see a physical therapist. The reason why is, so all these tips I've given you, they are precautions, right? They are things that we can do right now to reduce your risk of falling, particularly while you are at home. But in the end, they're not going to address the source or the problem of your balance or your dizziness complaints. In order to really treat yourself and to get those symptoms you're experiencing better and to really prevent yourself from falling, you need to see a physical therapist. We are extremely passionate, particularly physical therapy and balance centers, about educating the community on ways that you can reduce your risk of falling, because although there absolutely is truth in the fact that as you age, your balance worsens, there is 100% truth behind the fact that there is something you can do about it, and there are ways to stop that from happening.
That's fantastic. Now, you did mention, obviously, seeing a physical therapist is last but certainly not least, probably one of the most important things. I understand that physical is new to the telehealth world. So tell us, are the clinics open, and tell us about the telehealth program in general?
Absolutely. So our clinics are open, and we really do want you feeling confident knowing that there have been a large number of protocols put in place that we are following on a daily basis that focuses on disinfection of people, but also on the environment. We're all wearing masks and we're wearing gloves, sanitizing in and out. We're limiting the number of people in our waiting rooms on a daily basis. There's a lot of protocols we have put in place to make it as safe as possible for not just our patients, but also our team members. And so, of course, if you want to come into the clinics, we would love to see all of your smiling faces, but we also do recognize that right now, being in a clinic might not necessarily be for everybody. So yes, we are super excited about the fact that not just physical ourselves, but physical therapy everywhere is now getting this to do telehealth with our patients. And so this is really a really drastic change for us, just because, when we started this whole thing with COVID-19, a lot of our patients, they wanted to be put on hold because of fears and whatnot. And so it really halted their recovery. And so now with telehealth, it allows us to continue to be face-to-face with our patients, and we can sit there and talk to them about their concerns, and we can evaluate you, and we can treat you face-to-face. So that way we continue to help you on your path to recovery, on your path to better balance, better strength, and honestly on your path to loving your life again. And so we really want to see you all, whether that be in person or via video conference. We would love to see you and really get you on that path to better balance and help really in the end reduce that dizziness and reduce your fall risk so that we don't end up increasing the statistics we're already hearing. So absolutely, come in, come see us, ask us about telehealth. We are open to all options.
That's great. And I know that you had mentioned that you guys are offering some free screenings. Did you want to go over some of that?
Absolutely. So yes, right now we are offering free fall risk assessments. So if you contact us, and I'll show you a way to contact us in 1 minute, but if you do contact us and just say that you saw me on Senior Blue Book, we would be more than happy to offer you a free fall risk assessment. And so what we would do is we would take you through this entire assessment, looking at how your balance is currently doing. We'll be able to compare you to others your age so we can see where you stand right now. And then from that, we can figure out what the best way is to treat you. And we'll go ahead and start treating you immediately. And so I'm going to hold up another sign. Like I said, I'm visual here. But we have two main ways to contact us. You can contact us via 833-PHYZICAL, spelled FYZICAL, or you can go to our website, which is physicalsouthwestflorida.com. There is a button there in which you can press it to contact us. We would love to hear from you. Any comments, questions, concerns that you might have, please just give us a call. We would love to talk to you.
That's fantastic. And as soon as we're done here, I will make sure to edit the video, the live video, and make sure to put that information up. I also, over the years, have heard so much about what you do for Parkinson's, and being that we are at the end of Parkinson's Awareness Month, I want to give a shout out to all our Parkinsonians out there and what you do for them. Can you just talk about that briefly for a moment?
Absolutely. So Parkinson's, as we know, it's a neurological disorder. It's a movement and coordination type disorder that really affects the way in which people move in their daily lives. And so a lot of what physical therapy focuses on is trying to normalize these movements. We practice a lot of functional activities, including just walking, standing up from chairs, standing up from the toilet, making turns, stepping over obstacles. We really want to take this coordination issue and try to improve it the best we can. And so we work on all of these different type of tasks to try to normalize it in some way or another. But something that physical also does, which I think is fantastic, because as I told you, we like to look at the full body, right? We don't want to miss anything, is that we will treat them just like any other balance or dizziness patient. We will put them through the entire diagnostic protocol that we have to determine, are their balance systems functioning appropriately? Because just because they have Parkinson's, it doesn't mean that there isn't also underlying weakness in other areas of their body. And so in order to make sure that we can address it all, we check out all of their systems and we see how they're functioning. So that way, anywhere that we find an issue, we're working in order to fix them, to strengthen them, improve their balance, improve their functional safety, so that as a whole, we're doing everything we can to make them as safe as possible in their daily lives.
That's fantastic. And it's Parkinson's is near and dear to my heart. My grandfather had it. I sit on the advisory board for the Parkinson's Association of Southwest Florida. And it means a lot to me what you guys are doing in the community. And I just want to thank you again so much for coming on the show this morning and spending a little bit of time with me, Morgan.
Yeah, no, thank you so much. Like I said, we really appreciate it. And I love being able to educate everybody. And so thank you so much for having us on.